the letter that I think was written to the council had some links in the letter, and I tried to open it. I tried to click on the links and nothing happened, and I think like my brain is shutting down. Is that like, can you even do that? Click on a link in another document, because like when I was clicking in the link on the links in the letter written to the council, I couldn't get any, go to the EE agenda happening.
I'm looking at it right now. I'll try to click on the links and see what happens.
There's links in that, like.
Oh, okay. I think Miss Amy might have pulled it up for you.
Okay. Like, cause I couldn't click in. Okay, you're having trouble too, Miss Amy.
Yes, I am.
Okay, so maybe you were never supposed to. Maybe we can't. The general public can't access those links.
Yeah, if we can't get it fixed, then I'll ask Meredith to just maybe just provide me with the links. And then you may not be able to click in the letter, but then you'd have access to them.
All right, for me, can anybody could answer this? Can anybody answer this one? Because I'm agreeing with Jill Hooks, and that how can we link on with the letter and get the copy of it? Because seriously, I want to at least have a copy of it for my files as well.
We'll email it to you, Rosalind.
Please, I would really appreciate that.
Okay.
You know.
Okay.
Mr. Chair.
All right, thank y'all. So it's now 1:03 p.m. The meeting is called back to order. I hope everyone had a great lunch. So the next item on the agenda is the report of Louisiana Rehabilitation Services. So the chair recognizes Ms. Melissa Baham for her report.
Hi.
Excuse me for one little thing. Mr. Chairman, if I may speak, I know I'm speaking out of turn. I will be getting my COVID testing at 1:45. I will be leaving.
Okay.
And
thank you.
Would I be excused at that time?
Yes. Thank you for making us aware of that way. If by some reason we end up having a vote or something, we'll know what your position is.
Oh, thank you.
Okay, thank you. Okay, Ms. Baham, please proceed.
Thank you so much. I'll go over some highlights of my report and a couple extra things that I want to let you all know, and then I can obviously take any questions. The beginning of my report, we provide statistics on our different programs. The first program being pre-employment transition services, which is our services for students with disabilities. And then we have our statistics for vocational rehabilitation, including some information that the council has requested, which includes DD open cases in vocational rehabilitation. So we have those statistics for you by region as usual, as well as how many closures we had for the population. and how many referrals and closures we had for our rehabilitation employment development specialists, which are our in-house job developers. I want to note under Administrative Services, Louisiana Rehabilitation Council, that section was inadvertently not updated. The next meeting is actually next Thursday, October the 28th. It's typically the Thursday after this meeting. So it does take place next Thursday, and the agenda will be posted on the boards and commissions website. We also have some information about our rehabilitation employment development specialists and just some different training that we've had over the past quarter. A couple of things that I just wanted to highlight. We have implemented a vendor portal. It has gone live. This is for our vendors that we do business with, and it's supposed to help us to receive invoices and documents electronically, so that if you are a vendor for LRS, that has been implemented, and we're trying to get that off the ground. It's just one of our many things that we're trying to do to make processes more efficient. I also want to, and I don't think this is in the report, but I want to thank the DD Council and other various organizations that have helped us to get out our, we have to have, every 3 years, we have a needs assessment. And that was posted on the DD Council, I know definitely their Facebook page. So thank you to everyone who has completed that. And if you have not done so already, I encourage you to do so. We want to hear from you and what needs individuals with disabilities have. One update on offices. All of our offices are reopened with the exception of our Homa office. We are seeing clients, and our staff is doing a great job figuring that out. All the damage has been repaired to the office, but prior to the storm, the air conditioning was on the brink, and now it's completely out. So we're working through the procurement process to get the air conditioning working back in that office. So most of the staff are teleworking. Some staff are coming to the office. And the last thing that I wanted to report, and this is very new, and I may have mentioned this in previous meetings that we had applied for this, but we actually applied with Michigan Rehabilitation Services for a 5-year discretionary grant. And Michigan, who is the actual grant holder, we did receive that grant. So we are a subrecipient, and we will also be subawarding some of those funds to Southern University. And the goal of that project is to develop and use career pathways that assist VR eligible individuals with disabilities from racial, ethnic, minority, and other marginalized groups into competitive integrated employment and demand jobs in science, technology, engineering, mathematics, and medicine. So we were just awarded that a couple of weeks ago. So we're definitely still in the development process. But through this project, we're going to use different methods, including social cognitive career theory, to be able to better assist individuals with disabilities in those marginalized groups so that they can either enter into or advance in STEM occupations. So that's all I have prepared, but I would be happy to take any questions.
All right. Thank you, Ms. Bayham. Do we have any questions from council members? Jill, I see your hand. You're recognized by the chair.
Technical question. My brain is tired. Sorry. When you say open offices opening back up, that's a tricky phrase these days. Do you mean from the storm, or do you mean from the hurricane?
I'm sorry, Jill, that is a great question. And I think because I've repeated myself so much, but then y'all obviously don't work here, so it's probably not repeated for y'all. Our offices have been open for a really long time. So I was actually referring to after the hurricane, because and I don't know the specific time period, but our offices have been reopened from COVID for quite a while. Typically, we're by appointment only, or you call. You'll see a note to call on the door, just so we can make sure that we maintain those social distancing. But when I refer to the HOMA office not being reopened yet, that is simply because of the air conditioning, which was after the hurricane. But yes, does that answer that? Great.
I think because I knew your calls were after COVID, everything was by appointment only, and I think I somehow associated that with the word reopening, but that's all cleared up. Thank you, Melissa.
Thank you.
Thank you, Ms. Hando, and thank you, Ms. Bayham. Do we have any more questions from the council members in regards to the report from the Louisiana Rehabilitation Services, LRS? I don't see any hands. Do we have any questions in the chat?
There's nothing in the chat and no attendees' hands are raised.
All right. Thank you again, Ms. Bayham. The report requires action to be placed in the file. So next item for business is the Department of Education. So now we'll have our education report.
Is Meredith Jordan listed as an attendee, or has she been moved over to a panelist?
She's in the process of moving over to panelist.
Thank you, Brenton.
Okay. Thank you, Brendan.
Hey everyone, Meredith here. It's great to be here. Thanks, Amy, for joining me into the panel. So I'll start. I heard some of the questions earlier around the letter, and I apologize. Those should be active links, but I'm working on getting those into an email to Amy now, so those can be shared. Likely when it was scanned or transmitted, those links somehow did not get translated to live links. So I apologize to that for that, but we'll get those links to you. And so just to kind of recap, the letter response to the previous chair really was meant to answer two key questions that were posed to Dr. Brumley and the department around our safe reopening guidelines, which were linked in the letter, and you'll get a link to. And then second, addressing continuous learning and ensuring that we're supporting our educators and our students with disabilities who may still be learning in various modalities, including possible virtual learning this year. And so how will we address those challenges and support our educators and support our students and families across the state? So there were several links in there with ways that we are currently doing that, but of course, welcome input and feedback, and know that we'll constantly be evaluating that situation and supporting our educators, supporting our students in every way that we can for years to come, to try to address some of the challenges as a result of school closures from the pandemic. So I just wanted to kind of recap that letter and address the issues around the live links. I apologize. We'll get those to you. So to kind of go through the remainder of my report, I wanted to bring to this council a lot of ways that we are, and just do kind of a general parent-family engagement update. The first item there was the requested report from District Management Group from the July meeting. And of course, you all know I was coming into that, and so did get my hands on that report. And so you'll see here, and this is part of a larger consultancy with DMG. So this report was part of that. And so you'll see here around the process, the focus groups, the interviews that were conducted with key stakeholders. And the report should be linked there. Amy, I'm not, that one that you have pulled up is not showing that that's a live link either, but we have that report that you can really go into and take a look at who were the stakeholders represented, what districts, what stakeholders, what key groups, for example, this council was included. And then the report includes 4 strengths that were identified by the stakeholders. And so the report kind of took all of those focus groups and summarized all of that feedback into these 4 strengths. And so those are listed here. The report gives a little bit more detail around each of those. And then there were 8 key opportunities identified. We did have a lively discussion yesterday in the committee, received a lot of feedback around this. The opportunities that were identified. And so those 8 are listed here. I won't go through all of those again, but definitely we'll field some questions at the end around this report if there are any. The second update around parent and family engagement yesterday centered around our Families overview. Our Families Help and Families centers are a critical partnership for us. We're working with all 10 of those centers. And I'll also mention, I know we heard the LRS report, but on our monthly calls, I communicate to our SPED leaders communications for our Families Helping Families centers. So they have those contact information, the contact information, how to reach out to our centers, as well as our LRS regional centers. So we're communicating those resources to our school districts. We know this is that Families Helping Families is a critical resource for our districts in supporting our families and our students. And so these staff are uniquely positioned to provide support. They will go out and provide training even in our school systems to educators. They train our families. And so we really wanted to highlight that partnership here. They are working on work plans with us. We're in constant communication with them, doing check-ins around their activities. How can we help them? How do they help us? So it's a really two-way partnership with them. And then I also included here the many ways that our parents and families can support their students with disabilities during the school year. There are some key resources there that I linked to. We have a family support toolbox on the department's website. We also have back to school parent guides this was the first year that we separated those into pre-K through second grade, and then our 3 through 12 parent guides. We also, I linked to also our 2021 back to school parent guide for students with disabilities. And I also linked to our literacy landing page that is constantly being updated, but there are some resources there for parents and families to support literacy at home. The next update on my report is around high cost services. I know we bring this to this group annually and kind of provide an update around this program. We established this grant to support our schools and our systems with our students that have some of those very costly needs. And so this particular grant provides additional funding. Our school systems are in the process of submitting their round 1 applications now. So we released this in 2 rounds. For the main reason we do that is we're catching our current students right now. We'll do another round in a few months, and that will catch any students maybe that were mobile during this period and allow systems who have new students coming in, maybe that they didn't request funds for in round 1, they're able to request those funds for those students in round 2. And then the last update here was around our alternate assessment participation waiver. This is something that annually we have to submit a waiver to the U.S. Department of Ed around our alternate assessment participation rate. So the ESSA, the Every Student Succeeds Act, requires that school systems not exceed 1%. As a state, our preliminary results from last year are that we're at 1.4%. We're going in the right direction here, but we also want to provide those students access to the appropriate assessment. And so we apply each year for a waiver for that federal requirement. And so we're seeking a waiver extension. We already have an approved waiver. We need to extend it for this school year to cover our alternate assessments that begin in February. We are also, we have our public comment. The public, parents, our educators can submit public comment around this intent to our special education at la.gov email. I can drop that in the chat if that's appropriate. But just to repeat that, you can submit public comment on this intent to special education at la.gov. But I definitely wanted to bring this intent to apply for this waiver to this committee because I know it's a piece that this committee is certainly used to hearing about. And that concludes all of my items.
Thank you, Ms. Jordan, for that report. Do we have any council members with any questions in regards to the report from the Department of Education? Ms. Heimel, I see your hand. You're recognized by the chair.
All right, for one, a little bit, you have to catch me up on it, but I was following you. But is there like anything new into your report that is different from the last report that you had from yesterday when I was online and everything? Or is this still the same report?
This is the same information, Ms. Heimel.
So what this the IDEA is, what is that kind of would help out with the students and the disability kind of thing in what states are there? Are they included in the state of Louisiana or just in the state of Louisiana alone in the countries? I mean, little cities.
I'm not sure, Ms. Heimel, I completely understand your question, but IDEA covers those are federal requirements that are regulations that apply to all students with disabilities across our country.
All right, that's what I wanted to know, because if it was in all the states or just in our state alone.
That's right.
I wanted to really find out.
Yes, ma'am.
Thanks.
All right, thank you very much. Do we have any other council members with any questions in regards to the report from the Department of Education? I don't see any hands up. Do we have any public comment or any questions in regards to the Department of Education report? Ms. DeVille?
Mr. Charles Michelle has his hand raised.
Mr. Michelle, you're recognized by the chair.
Thank you, sir. Meredith, I just have a couple of questions. When you were talking about the high-cost services program, I remember when it first started, it was on a cost reimbursement basis based on the like 3 times the amount that it would typically cost to educate a child. they would give you some money over that amount. However, it's subsequently changed way before you got here. It subsequently changed into more of a predictive thing. So we have a student and we predict how much it's going to cost, and we would get that money based on those predictions, regardless of the actual expenditures. We asked for years to get it put back to a cost reimbursement, and I was wondering if y'all are looking into that, if that's a possibility. Because to me, from an accounting standpoint, it's much more its accountability is much more easily accessed if you do a reimbursement, because it's actual cost expended, not what we think. That's the first question. Okay, and I guess I'll go with the second question. The alternate assessment, again, back in the day, well before you got here, the criteria to be eligible for the alternate assessment, back then called Law 1, was expanded from 3 standard deviations to 2.5 in certain circumstances and 2 in certain circumstances. That, by design, increased the number of students eligible to participate in that alternate assessment. That drove many districts above the 1% cap that was allowed. There was quite a bit of discussion about that, some for and some against. But because of the change in criteria, have y'all done any kind of study to see how many more students are participating in the alternate assessment now than they were before y'all opened up the criteria? Because to me, that would be some good information to see if that's the reason solely that we are above our 1% mandate. That's it.
Ms. Jordan, you're on mute. Thank you, Dr. Michelle.
You bet.
Yeah, thank you for that. Yes, we are, we're moving in the right direction. So from what I can tell diving in, this past school year, our participation rate was 1.4%. Of course, we had 1920 where we didn't administer assessments due to COVID. But the previous year before that was 1.5% and then 1.6%. So we are steadily declining and getting closer to that 1%. However, we know that it's an IEP team decision in looking at a preponderance of all of the data, all of the evidence around each individual student, what assessment is most appropriate, which is why, of course, we apply for this waiver every year. And you're right. So the criteria change, I believe, is helping us to get closer to that federal requirement, because now the latest criteria change, I think maybe over a year ago, 2 years ago, now you have to meet both the adaptive criteria and a cognitive criteria, whereas before that criteria was an and or statement. So you're right. So the criteria has gotten a little bit tighter to make sure that only students with the most significant cognitive challenges are those participating in alternate assessment. And because once you're participating in alternate assessment, it drastically kind of narrows, right, your pathway and your exit from high school and the opportunities. So you have very, very good questions. And again, that's exactly why we have to apply for this waiver, because we know and we can predict, based on our past few years of performance, that we know this year we will remain over 1%. And I'm not sure exactly how many years we've been applying for this waiver, but it's been quite a number of years in our state that we've had to apply for this waiver. The positive side, as I'm on calls with other states and state special ed leaders, is actually last year, even through a pandemic, we met the other part of this federal requirement, which is that 95% of our students, including disabilities, must participate in our statewide assessments. And we exceeded that. So we met that federal requirement. That's a federal requirement that we've always been meeting. So we do a good job. Our systems do a good job of ensuring that our students are participating in these assessments and have access to these assessments. And to answer your high cost question, I can also link you to our state plan, but you are correct that, so the fund is made up of, part of it is funded through our IDA allocation. IDA funds part of our high cost services grant, and then the MFP formula also funds a part of that. And it is based on an average pupil per pupil expenditure. And then, you know, and they can apply for, it's a total cost in excess of a certain amount of dollars. We have that spelled out in a plan. If it's appropriate for me to drop that link in the chat, I can certainly do that, Chair, to that state plan that really explains how that's funded.
Please do. That way it'll be available in case anyone else has any questions. And if one person has a question, there may be several with the same one. They just didn't have the opportunity to ask. Thank you for that. Do we have any
I'm
other
dropping it in now.
council members?
No one else has their hand raised.
Okay. Do we have any public comment?
No comments in the chat.
Okay. Again, thank you for your report, Ms. Jordan. You'll be reported. Okay, I see you made the comment. Drop the link. It'll be recorded to file. Now we're moving forward. Next item of business for the report is Office of Aging and Adult Services. Do we have a representative? Do we have a representative from the Office of Aging and Adult Services to present a report?
It's likely that we don't have a representative on the call. They did submit a written report.
The written report was made available prior to the meeting, correct?
Yes, it was.
Okay. For the sake of council members, unless you see differently, if it be the pleasure of the council, we'll move to the next agenda for business. So now we'll be down to we'll make sure that we record that to file. And now we'll be down to the report for the Office of Citizens with Developmental Disabilities. Do we have a representative?
Hello, this is Julie. Can y'all hear me?
Yes.
I had internet issues and I am almost to a location where I'm back to Wi-Fi. Would it be possible for the next person to go and then come back to me at the end? I apologize.
No problem, Julie. Thank you for making the situation known. We'll
okay.
Yours. Do we have the representative from the Office of Public Health?
You do.
Okay. Ms. Vecchio, you have the floor.
Thank you so much. So my name's Patty Vecchio. I'm from the Bureau of Family Health, which is housed under the Office of Public Health. We house the Title V Children and Youth with Special Healthcare Needs program. As you can see by my very lengthy report, we support many programs that serve the community of individuals with developmental disabilities. We have Children's Special Health Services, which includes direct service clinics in areas of the state where subspecialty providers are not available or the service is inadequate at this present time. We also sponsor a family resource center, which is now transitioned to a statewide virtual resource. So this resource center can provide supports for any pediatric family medicine provider in the state or any family of a child or youth with special healthcare needs that needs any type of resource linkage support. And that would include anything that would touch that child. It can be housing, it can be food insecurity, it can be provider linkage, service linkage. It does not have to be health specific. And so the BFH is also a partner with Families Helping Families. We have the Bureau of Family Health, Families Helping Families Project, which again, we're working to ensure that all children and youth with special health care needs and their families have access to community level resource and referral services. The Bureau also administers the genetics program, which does that newborn heel stick on every baby born in Louisiana. You can see the updates for that program contained in our report. We also conduct the newborn hearing screens also in the newborn population. In addition to that, the Commission for the Deaf sits under the Bureau of Family Health, and along with the Louisiana Birth Defects Monitoring Network. All updates for those programs you'll find contained in that report. And just to also note that we also administer 2 family support and coaching models, which is the Nurse Family Partnership and the Parents as Teachers. We also administer school-based health centers in the state, those that are under the direction of the Office of Public Health. I'm happy to take any questions. You will find specific program information within that report.
All right, thank you for your report. Do we have any questions from any council members? I'm not seeing any hands. Do we have any public comment or any questions?
No attendees have their hand raised and there's nothing in the chat.
Thank you.
Thank you for your report. Your report will be placed on file. Now we're up to report from the Governor's Office of Elderly Affairs.
Yes, this is Sherry.
Representative.
Good afternoon. So I have made some edits to the report.
Please proceed.
Okay, so GOEA is the designated state unit on aging, and we administer the Older Americans Act program services. So the services that we provide are listed below. I'm not going to go into each one of them specifically. Other services that we provide are by partnerships with the Senior RX Prescription Assistance, National Family Caregiver Support, also the Louisiana Medicare Improvements for Patients and Provider Acts, well known as MFA, and the Senior Employment Program. We also handle the Long-Term Care Ombudsman Program. There's a little bit of information there and a number. We also have Elderly Protective Services. We have, since COVID, we have opened 6,246 cases. Currently, we have 2,594 open cases since July 1st. 1,541 of those cases have been closed, with 144 cases being classified as high priority. The types of reports of abuse that we do receive includes caregiver neglect, emotional abuse, physical abuse, sexual abuse, self-neglect, and there's a couple other that we receive as well. Due to COVID restrictions, we are not able to do the face-to-face interviews for medium cases or the high priority. So we kind of get law enforcement involved if we have to on those high priority cases. We have our Aging and Disability Resource Center, where it's kind of a clearinghouse for an array of long-term care options, prescription assistance, other resources available. Especially with COVID, we had some assistance for the Blue TARP program and a couple of other programs that all funneled through our ADRC if anybody calls looking for those types of services. We have Louisiana Answers, which handles our Senior RX program. to help with the prescriptions. We also have them to help with the SNAP, DSNAP, FEMA, utility assistance, food supplemental programs. All that can be found on our LouisianaAnswers.com portal, as well as our ADRC locations. Our Mfa program, our open enrollment started October 15th, and it'll run through December 7th. That project that program helps with enrollment assistance for low income subsidy programs, Medicare savings programs. They also conduct a Medicare Part D counseling and enrollment assistance as well with those. GOEA continues to work with MDAC, a feeding task force, and other response recovery support function groups. These activities are structured to plan and implement activities prior to an emergency, during an emergency, and post-emergency for recovery for the constituents of the state through most of our councils on aging. We serve as an effective and visual advocate for the elderly population of Louisiana, ensuring seniors in need receive appropriate services from providers in the agency network. We submitted a disaster grant for Hurricane Laura back in February of this year. We did receive the grant finally on September 27th in the amount of $100,000. However, the grant was to end on September 30th. So GOEA had to really turn around and submit a no-cost extension on September 29th, and we were granted that extension, which allows the grant to now go through September 30th of 2022. We're currently working on those contracts to help Cameron and Calcasieu Parish to provide $50,000 to each one of those parishes to help those constituents with those items such as toiletry items, which would include blankets, towels, sheets, normal things that would not necessarily be covered by insurance. So they're going to be able to help those constituents regain some of those toiletry items. Also, if they have a need to replace shelf-stable meals that were given out during that time, they can also use that as part of replacement to replace those meals. We have now moved from our current our last location on Florida Boulevard. We have now moved as of October 11th to 602 North 5th Street, which is known as the Galvez building, right next to LDH. We have implemented a auto attendant for our main line. So now when you call, you'll get those automated prompts to press 1 for this unit, 2 for this unit. We believe that helps streamline some of the calls that we get and alleviate callers being transferred from person to person if no one does answer the phone line. And I think that covers everything in the report, and I will send the updated report to you so that you have it.
Great,
Any
thank you for your
questions?
report. Ms. Crane, do we have any questions from the council members in regard to the report that was just presented?
I'm not seeing any hands raised. Oh, Rosalind just raised her hand.
Ms. Rosalind, you have the floor.
Thank you, Mr. Chairman. What I wanted to know, are y'all still in the state of Louisiana for one, and where is y'all's location? Once again, I was trying to understand where y'all's location. And
Yes.
is it like across the river or y'all on this side? And how can we get in touch with you or any other people in your office or whatever case may be with other clients that you mentioned in Part D in that?
Yes, ma'am. So we are located downtown Baton Rouge. We were on Florida Boulevard, but we are now on the corner of North and 5th Street. So we're still downtown. We're like 2 blocks from the Capitol. So our phone number to our main line is 225-342-7100. Most all of our councils on aging, which is we have one in every single parish, you can contact that parish council on aging and they can help you with any questions that you have with your Medicaid Part D enrollment. Or we also have a toll-free number. That number is 1-877-340-9100.
Can you
I
give
think
me
that
the other
answered
number
everything.
that you had, please?
I'm sorry?
Can you give me the first number you were saying?
Yes, ma'am. It's 225.
Is it
3
two
4
twos and a 5?
Yes, 225 is the area code. Then 342
3, 4,
2
2,
7100.
7. What was after the 1?
00.
2 zeros?
Yes, ma'am.
Alright.
I think I answered everything. Did I, Rosalind?
Yes, you did.
Okay.
All right, thank you for that. Ms. Hayno, I see your hand. You're recognized by the chair.
I'm sorry, I didn't lower it. I'm sorry.
Yes, I've heard a bunch of agencies talk about that, especially with COVID and all the hurricanes. On this council, who besides the governor's office of disabilities affairs, who else is associated with MDAC?
Yes, ma'am, Miss Jill. What we do is we do partner up with MDAC, so we are also a presence on that board with Bambi Pozzolota. I'm sorry, I can't ever say her name right. I apologize, Bambi. But we also handle any type of services that the elderly 60 and older needs, whether it is homemaker services where we provide services to come out, help you clean your house, you know, help you take a bath, whatever it may need. They help with groceries. They provide transportation to doctor's visits, dental visits, stuff like that. Did that answer your question, Ms. Jill?
I'm sorry, it did not. Like, other than y'all in Bambi's office, who on the council, what agencies on the council partner up with DAC?
So is it, you want to know what other agencies partner up with MDAC other than me and Bambi?
Yes.
Okay. And I think Bambi can answer that more readily than I can. I know that OPH, the LDH is presented. The GOSEP is presented. I'm trying to think, but I think Bambi can answer it more readily available than I can as what other agencies participate on that.
Excuse me for a
You're
second.
recognized by the chair to give that response.
Excuse me, Mr. Chairman. I'm getting ready to leave now. So I should be back in 3 minutes. About 3 to 4
Thank
minutes.
you. Okay, thank you.
Well,
One second. Let me, before we go too far, I want to make sure that your question gets answered, Ms. Hayno. Ms. Polos.
Will you send me a direct message in the chat, please? Because
what I'll do is we have a Google Doc with the list of everyone. I can drop that link in the chat and you can see like the names, the organizations of everybody who is in works with MDAC. Would that work?
Yes, that'll be fine. And if we have any more, we know exactly who we can contact. Do we have any more questions from any council members in regards to the report that was presented?
Thank you, Bailey.
I think Jill still has a question. Jill Hano, and then Jill Eagley also has her hand raised.
Okay, Jill Hano, you're recognized by the chair. You're muted, Jill.
Can I save documents onto this laptop, Miss Amy? Because I've been saving documents all day. Like, can I do that if I delete them when I turn in my loan?
Yeah, you can do that before you turn in your loan. You'll just get all the documents off of it.
Okay, because I've been doing that like the whole time, and like, I think this is okay, but thanks. All right, sorry.
Thank you for that. Chair recognizes Ms. Jill Eagley.
Chairman, Mr. Rashad Bistro, I have something that I have to deal with, so I'm gonna have to log off, but I have a quick question in terms of, I know effective October the 1st of this year, the rates went in effect. What does that mean? Is that the state of Louisiana or the government?
So which rates are you referring to?
Rates through the ARC of Greater New Orleans?
That's a good question. I'm not sure on that one. I will have to look and see and get back with you.
Okay.
Do you have? I'll put an email in the chat if you want to write it down, and you can send it to me, and I will gladly look it up for you.
And I just want to make sure, and Ms. DeVille, this goes to everybody, DD Council staff and all the DD Council, the members and the panelists and everybody. I know that this time next year I have to end off, but if you could send me the application, or whatever I have to do to get back, because without the DD Council, I felt like I had nothing. And I want to always represent the DD Council to the fullest extent, so all people with developmental disabilities can have the best lives ever. So I don't want to lose this connection. I mean, I don't know if I hope that y'all all look up to me, but I've been through a lot, and I always want to represent anything I can to my fullest extent.
Thank you for that. And I'll make sure we give Ms. DeVille. It's that kind of passion that keeps the DD Council focused on what's important. Do we have any more comments from council members, or questions from council members in regard to the report? I didn't see any more hands. Do we have any public questions or comments in regard to the report that was presented by the Governor's Office of Elderly Affairs?
Mr. Chairman, Julie Hagan did respond in saying that the rate increase was for home and community-based waiver services.
Okay. Thank you for that, Ms. Hagan. And we haven't forgotten about your presentation. I was just trying to give you a chance to be stationary in a fixated place. So hearing no more comments or no public comments, we're gonna file the report that was given by Governor's Office of Elderly Affairs. Now we'll move forward to the Bureau of Health Services and Financing. That'd be Ms. Zimmerman.
It is. Hi, everybody. I'm Kelly Zimmerman. And if you haven't already heard, Jen Katzman, who served on this role, has accepted another position. So she is now working in Shreveport. And so I am sitting in for her, and will share the report from Medicaid. And so we did share the report in advance, and it is here on the screen. And so I will go over the highlights. And so the first item in the report is about the American Rescue Plan Act. And so this is the act that is allowing us to take advantage of a temporary 10 percentage point increase to the FMAP for certain Medicaid expenditures for home and community-based services. And so the Department of Health has been working really closely with CMS along with all of our internal program offices within the agency to develop a spending plan that we could propose to CMS. And so we have now submitted our HCBS spending plan that looks at all the different ways that we can really utilize this enhanced 10% increase in the FMAP and to share that to help enhance HCBS services. And so that has been submitted to CMS. It was submitted October 12th, I believe, so last week. And we are now waiting on CMS approval for that plan. And so that is exciting news coming, and we're just waiting to hear back from CMS at this point. The next update is about our children's Medicaid option, TEFRA, and you heard a little bit about this earlier. We were pursuing the 1115 waiver route and have now since changed that over to a state plan. And so that is with CMS pending review and their approval. We have been working with CMS on some questions and answering every question that they have. And we do plan to implement this for January 1. And so just waiting for our final CMS approval so we can go ahead and move forward on that. We have an update on permanent supportive housing services. There are currently 4,801 individuals being served in 2,869 households providing permanent supportive housing. On Money Follows the Person, so far 183 individuals have transitioned in calendar year 2021, this calendar year, transition through the Money Follows the Person program in the OAS and OCD qualified institutions. Let's see. We have an update in our report on self-direction. So this says that we have just about 1,800 individuals participating in our self-direction program. And so you can read a little bit of a summary here in the report. And then same for electronic visit verification. So our contractor SRI continues to train and work with providers for in-home electronic visit verification just to make sure that Louisiana complies with the requirements of the Cures Act. And at this time, approximately 93% of providers are meeting the state benchmark of 80% electronic visit verification. And I think that's the highlights of the report. I'm happy to take questions.
All right, thank you for your report. Do we have any comments from any or any questions from any council members in regard to the report that was just presented?
Nothing from the council. There is a comment in the chat.
Okay, well, what was that?
What is the application process for Act 421? Where do we direct families who may be eligible for this option?
So now that it is through our state plan, it will just be like through the regular process to apply for Medicaid. And so we do have a web address, a web page for this program, and we continue to update this website with the most relevant information. So right now that web address is www.ldh.la.gov/Act 421. And there you can see it on the screen. But it's just like any normal application into the Medicaid program.
All right, thank you for that. Do we have any more questions or public comment for the
I'm
report?
not seeing any more. Oh, Bambi has her hand raised.
Okay, Ms. Polozola, you're recognized by the chair.
Yeah, so you said it's just like any normal application for Medicaid, but it's not it's a special class of people who qualify for this. And I know most Medicaid programs are a special class of people. So can you just go into a little bit more that process, so those that's listening, I know a lot of people support people who will be trying to get this type of Medicaid for their child.
So, right. And I may need to come back in and fill in some of the blanks, but as I understand it, and Julie may need to chime in here as well, but a person would go through the application process in our Medicaid program, and then the analyst would help direct them to this appropriate option. And then the local governing entities will help us with sort of the evaluation and to make sure the members are in the appropriate program. And Julie, please fill in if I've missed something.
If I could just one more comment, I know what's happened in the past in regards to like Family Opportunity Act, which is also an option for this population, that sometimes that was not, families weren't being made aware that might be another option for their child's eligibility for Medicaid. So I guess, my concern is to make sure that those people that are doing the Medicaid applications are really well versed, and there's some way to be able to catch that and make sure people are accessing Medicaid if they qualify, or those kids can access Medicaid.
Julie Hagan has her hand raised, and that might be to help fill in some blanks.
Ms. Hagan, you're recognized by the chair.
Okay, so everything Kelly said was correct, and we are, working to make sure on the intake side that that folks understand. I did just want to provide a little bit more clarity in terms of which children would qualify for this, and in terms of what the assessment that the local governing entities will do for us. There are three levels or three different criteria that make somebody eligible for the TEFRA program here. It is that they meet ICFDD level of care. And for now, basically any child who has an OCDD statement of approval would then, we would have to do what we call a 90L. But the majority, if not all of the people who have an OCDD statement of approval are noted to meet ICFDD level of care. So that's one entryway. And then there are two other entryways into the program, and that is nursing home or nursing facility level of care and hospital level of care. And we worked with a stakeholder group to develop this assessment for here in Louisiana. And so if we have children who don't have an OCDD statement of approval, but their families feel that they may qualify through that nursing home or hospital assessment process, then they would, the local governing entity will be, and that's what Kelly said, when you register, that'll trigger the local governing entities reaching out and seeing if they meet that level of care. We do think that there will be a lot of children, or that there may be some children, from 3 years of age to 18, but we do anticipate, because our children in the birth to 3-year-old population don't always, or there's not a clear path to get into OCDD with a statement of approval. We anticipate that the birth to 3-year-old population will be the largest number of children we see who become eligible for Medicaid. And so what this program does, if you're eligible for Medicaid in the traditional manner, based on, salary that you become eligible, then this is really no different. What this program is for children of families whose income doesn't make them eligible for Medicaid services, but they have a higher level of need, and so need some of the things that private insurance, or private pay can't take care of. This allows those children to become Medicaid eligible and then therefore receive services through our EPSDT state plan service. So just thought that might help make it a little bit clearer.
Thank you for that explanation. Very good. I see Miss Carmen Setner. I hope I pronounced your last name correctly. Hopefully I didn't butcher. You're recognized by the chair.
So I don't think that families will have trouble figuring out that they're finally eligible for something, but I guess I'm very concerned about the implementation process, because if we tell families who have never applied for Medicaid, have never even applied because they knew they were not eligible, or they don't deal with Medicaid on a daily basis, we tell them to go to the Medicaid website and apply, like do that long application, there'll be a few things that'll happen. Number one, they'll just get like a denial letter automatically, and they won't know to continue on because they're used to being denied services because of their income. And then they'll say, oh, well, I was denied, and they won't move forward. The second thing that could happen is that they won't kind of know how to navigate the Medicaid application in towards the TEFRA population application part. Is there some kind of, I don't want to say like safeguard or backup that like these families would be directed to Families Helping Families or to a specific department? Because I'll give you an example. During our lunch break, I spent an hour on the phone with Medicaid getting transferred 4 times for my son's waiver. So, you know, I just feel like these families are going to get stuck in a phone tree, and because they're not used to having to jump through all the hoops to get what they need. And they're going to be like, oh, well, I was denied, and they're going to move on. And then these children won't get these services that we have fought so hard to get put in place. And we finally have a program, and it's fully funded. So it's so exciting. And it's like my passion project. So I'm just kind of concerned about those families that get that automatic denial letter because of income, or they wrote the wrong thing, or they, you know, filled it out wrong, or they put the income and they were automatically denied. I'm just very concerned about on the back end, how those families will be pushed through the entire program system implementation.
And Carmen, I'm sorry, I don't know that answer right now on this call, but I did make a note, and it is something that I am going to bring back to our team who's working on the implementation to make sure that they hear this concern and can make sure that we have some mechanisms in place to help.
Okay, thank you for those comments, Ms. Carmen, as well, because it does get to be kind of stressful when you're going through these hoops. And a lot of people don't know, once they get the denial, at that point, they give up and they walk away discouraged, not knowing that there's other. But you have to be real tenacious. And that's another reason why we're here to counsel, to let them know that they, just because you were turned down the first time doesn't mean that you can't continue to persist. I was always told if the empty wagon gets the grease. So, but then again, I was raised by old folks, so I have a lot of cliches. Do we have any more questions or comments?
Liz Gary has her hand raised.
Ms. Gary, you're recognized by the chair.
Thank you so much. The only other thing I wanted to ask was when the Family Opportunity Act came out, that was a Medicaid also for, I think it was 350% above poverty, which opened it up for a lot of families who had kids with disabilities. I guess I don't understand that one. I don't remember having to meet the level of care, nursing home 90L. I know that when we were talking about all that during the whole conversations in Act 421, one of the reasons we were lining all that up is because of the 1115 waiver. So I guess my question would be is why does it still have to have those same criteria if it's the state plan and the Family Opportunity Act didn't have to have that same type of requirements?
And I'm sorry, I apologize. I do not know the answer to that question either. And I am not familiar with the Family Opportunity Act. And so that is, again, something I can bring back to our team and ask.
This is Julie and Liz, the level, and I don't have the details either, but the level of care is typically those the establishment of meeting a level of care threshold is typically in a TEFRA program. And one of the requirements in terms of just looking at the, that it's for children with extraordinary needs. And so that's sort of where it derived from, but Kelly and I can work together to make sure we have the right details on that.
I appreciate that. Thank you. Thank you, Mr. Chair.
Thank you, Ms. Geary. And I don't see any more hands raised or any more public comment. So your report will be added to the file. And Ms. Hagan, this is like you're situated. You've been answering several questions, so we'll go ahead and get your report from OCDD out the way.
Okay, thank you. And I apologize. I'm in an area that was hit by Ida, and it seems like every day is a new day in terms of whether we will have services or not. So thank you for allowing me to be a little bit delayed in my report. There were some things I was going to cover with you guys that we've already talked about a lot. So I won't revisit those. There are a couple things that I wanted to make sure that folks were aware of, though, and we have talked a little bit about this. So on October 1st, we did implement for our developmental disability waiver services that are provided by a direct support professional. There is a $2.50 per hour rate increase. So that's our in-home services, our day services. There is a list on our website that tells the specific services in each of the waivers, but it's either $2.50 or somewhere close to that, or an equal increase. Like for day habilitation services, those are done a little bit differently. So it's not exactly that it had to be calculated differently for things that were a per diem than an hourly rate. And so, but there was the increase. It did start on October the 1st. We had all of our programming in place, so providers began to receive that. We did hear that there were a handful of providers. There was some issues because of the way it was billed, but those are in the process of being cleaned up, so that reimbursement can make sure that it took place. With that increase of $2.50 or approximately $2.50, there is an expectation that direct support workers be paid a minimum of $9 per hour. And so starting early next year, OCDD will be going in to do some auditing of payroll records and things, just to make sure that that the direct support professionals are being paid that minimum of $9 per hour. And we did some rulemaking associated with that to allow us to be able to go in. I know earlier in the council meeting today, there was discussion about the discrepancy with and OAAS, and Kelly just advised you guys on the American Rescue Plan Act. And one of we did hear from you guys about the concerns about those potential inequities. So one of the activities in our American Rescue Plan Act is to also give a rate increase to our Office of Aging and Adult Services providers. Our rate in the New Opportunities Waiver and the Residential Options Waiver for in-home services starting October 1 is now $18.50 per hour. And so in the American Rescue Plan Act, we're asking for funds to increase the OAAS direct care services and long-term personal care services to the same $18.50. We are not able to implement any of those activities until we have CMS approval of our plan, and we haven't gotten approval yet. But once we do, then if CMS approves us to use the funds for that rate increase for the Office of Aging and Adult Services, then we would plan to retroactively pay that to October 1st to be consistent with what we did in our OCDD waivers. So we also know that, and the American Rescue Plan Act will be placed on the CMS website, so folks can see what our spending plan is, as well as all state spending plans. They're going to be putting that on their website. But I do know, and I just wanted to highlight, I know in previous council meetings, there's also been a concern about not only our direct support workforce, but our nursing workforce when it comes to providing, skilled nursing services and extended home health services. So the American Rescue Plan Act also has a proposal to do some bonus or incentive payments to try to help us address that gap that we know is also out there. And then I won't get into all the details, but there are some other initiatives that we're trying to do, again, trying to help address the workforce crisis, hearing from folks that that's a big issue, not only with DSWs, but with other professionals. And then trying to also look at ways that we can use those funds, because they are there to help enhance home and community-based services. So there are some other activities that we are looking at using those funds for that we think will enhance our services. I also wanted to point out that within the next couple of weeks, there will be published the Louisiana Department of Health business plan. I'll make sure to share that link with council staff to share with everyone. And I was really excited that there are some things that you'll see a lot of really great initiatives that we have in there. This is Secretary Phillips' way of ensuring that the public knows about the commitments that we have as a department to engaging in activities to support all citizens of Louisiana. Some of the things that are specifically there that I thought might be of interest to the council is a commitment to continuing the work that was started on our to get comprehensive dental services for adults with intellectual and developmental disabilities. So you'll see a commitment to continue the work there. And I know that was mentioned as a legislative agenda item as well. So you will see a commitment in the business plan to that. We also have had a lot of talk about the rates and needing to just come together and figure out a way that we have a rate that that makes sense. So we do, there is also a commitment from Secretary Phillips there that what our office will do, because it's not only our home and community-based rates, but it's Medicaid rates across the board. So the business plan will include an initiative that will require that all Medicaid rates for all services in Medicaid go through a rate review. And that process is being worked out right now, but it will go through a rate review on a 3-year cycle. So all rate, we'll have rates that we review in year 1, year 2, year 3, and then it'll be an ongoing cycle so that we're engaging in dialogue and discussion ongoingly about what the updated needs are. And we do know that when we do get to the point where we're looking at our home and community-based rates, we'll need to engage stakeholders in that, especially some of the conversations you guys have had about how do we make sure, or how do we include a living wage for our direct support workers in there. And then some other factors that we know need to be considered, having nurse consultants and whatnot. And what are all of the things that need to go in the rate? That way, when we go to the legislature, we can make sure that we know how the rate was developed, and we maybe can have a more consistent message in terms of what the needs are to get us to a rate and then sustain us at a rate that makes sense for folks. So there is that commitment in the business plan. And then also you will see a commitment to begin. This is a long-term strategy. We know this will take a long time, but there is a commitment to begin the conversation about how do we start to tackle the workforce crisis that we have for our direct support professionals and other, like I mentioned earlier, the nurses and things like that. but how do we really begin to engage in a conversation? Because rate is part of the discussion, but it's also bigger than that. And so what activities do we need to start engaging in to come up with strategies to truly address the workforce crisis that we know is present here in Louisiana and quite honestly, just nationally. I'll also point out, I think Brenton shared earlier or during our community and self-inclusion meeting, we talked about OCDD is working to identify, every year we kind of highlight our major activities, but we're trying to be much more transparent with that whole process. So I will definitely share with you, we're working on finalizing an external facing document now so that everyone is aware what are the major activities that OCDD is working on. And then on a quarterly basis, kind of giving giving the public information on what progress did we make, if we ran into barriers, what those barriers are. And then, just looking to have that conversation. And so based on that, I did want to share, we are, our report is always very lengthy to the Developmental Disabilities Council, and we want to make sure that we're giving folks the information that they need. So we are going to be looking at, how we structure our report that's up there to be able to have the information that folks need to have in the easiest and best way to read format. Probably trying to restructure it a little bit more around sort of our major activities so that it's easier to read. And then we have identified some issues with the data and the way that the data is being reported, especially as it relates to like our request for services registry and some of the activities with our son screenings. So we want to make sure that that data is clean and that it's clear, because some of the numbers, when we drill down, I don't know that they're being presented in that most accurate way. So we want to be able to do that. So if anybody has suggestions on, ways that we can modify our report, please don't hesitate to reach out to me at julie.hagan, julie.hagan@la.gov, because for the next quarter, we want to work on that. One other thing I forgot to say about data, we know that it's important to the council that we, continue to have the funding that we need so that we wouldn't have to reinstitute a waiting list or a list where people who are screened as having urgent or emergent needs don't get a waiver slot. And there's been a commitment to keep money in $1 million in the NOW fund should we ever need to have additional funds for additional waiver opportunities. And so I'm also not clear that that data is laid out in the best way, because I know one of the things in the past, the council has said that it's important to them to be able to know that if we're getting close to the point where we may have to institute a waiting list or not being able to give offers to people with a 3 or 4, the council wants to be able to know how to trigger that. And so we're trying to rethink how we present that data to make sure that what we're giving you guys would help be able to see those trends or see what those patterns are. So again, we're more than happy to take any suggestions from the council on how we can make this most efficient and transparent in the information that you guys need to see. So I'll stop there and I'm happy to take any questions.
All right, thank you, Ms. Hagan. Are there any questions from the council members in regard to the OCDD report?
I believe Jill Hano had her hand raised.
Jill, you're recognized by the chair.
Thank you. Hold on, because hold on, Julie, I can never let you get off scot-free.
I wouldn't expect it any other way, Jill.
Right. Okay. Back to the rate increase. I know that was what my question was about. Okay, so our success with the legislation and the $2 rate increase for the caveat to go to the DSPs. But what did you say? Like, so now what is with the increases in place? What did you say the base rate was?
$9 an hour.
Oh, okay, then I don't know what base rate is. The other number, like 18 something.
Oh, so the rate that is billed is $18.50.
So it's oh no. I always try to do math on YouTube. So if the worker is getting the $9 an hour, if the total rate increase is $18.50 and the worker is getting the $9, and I'm gonna look like a fool, but is the remaining money, which would be some unnamed figure, does that go to the provider itself?
So let me,
operational costs.
So when I mentioned that one of the things I would really like for us to do is to try to get together a group to take a look at all of the things that go into the rate. So when providers bill, they don't get paid any other way. Most of our home and community-based waiver providers, they only are billing for Medicaid services. They may have, fundraising if they're a nonprofit and other ways that they get money that come in. But most of what has to happen is when they bill for the services they provide, that what they bill has to go to pay their direct support workers, pay workers' compensation, they have to usually have a nurse consultant, and depending on the level of need of folks, that's different. They have to have a actual facility building that they have to operate out of to get started. It's complicated because that rate is what they bill, and it includes paying staff, but it includes a whole lot of other things.
Okay, so
go ahead.
So it's okay. I don't know. Continue.
So what I would like to do, because we have some of those things when we develop the rate are considered, and some are not. And so what we would really like to do is work with a group of people that crosses providers and families and self-advocates to say these are the things that we understand are included in part of the rate. Now, there might be different percentages. For example, overhead is what you call the cost of the building and stuff. So what percentage of that rate should go to overhead? What percentage should go to profit? Those things we might need to tweak as we go. But if we could come to at least an agreement on all of the things that rate is supposed to be able to cover, then I think we would be able to have the conversation a little bit more, a little better in terms of, what if we do increases, then where are we increasing and what does that need to be? So the rate before October 1st was $16 an hour that they billed. And on October 1st, it became $18.50 per hour. So there was $2.50 an hour more that was given. During discussion, and here's math that I can't tell you. If you take $2.50 and then you take 70% of that. So we said 70% would go to the worker and 30% would go to the provider for the other associated costs. And so then you get 70% of $2.50, which in my head, I can't remember. I think it's $1.75. And you take $7.25, which is the current minimum wage, and you add $1.75 on top of that, that's where we got the $9 an hour. So 70% of the additional $2.50 goes to the worker because it raised the minimum wage up by that $1.75.
Okay, I'm gonna get this in the transcript, Miss Julie, but it's all coming together. But I do have another question that I don't think was in your report, but I was just general curiosity. I know that since COVID, a big issue, like now everyone on the council and that attends the council meetings should have so there's 3 main appendix K exceptions that we've been talking about since COVID, and we talk about the big 3. Is this making y'all dizzy? Every corner, but are there other, like, how, I know we're focused on the main 3, but how many appendix K exceptions total are there?
I don't remember the number off the top of my head, Jill, but at the big, so I mentioned earlier, we're having focus group meetings on the big 3 in the next 2 weeks. At the meeting we have on November 10th, the webinar for everybody to come and then be able to give us public comment, we're going to share the outcome of the focus groups for the big 3, as you called them. But we are also at that time going to share, we're going to go through a list of every single exception that was in place, and what the plan is kind of moving forward after the public health emergency for each one of those. And so you will have a clear, and we'll get the PowerPoint to everybody, but we're clearly going to delineate every single appendix K and emergency rule that we've done under COVID. And we're calling it in the department the COVID. So what the plan is post public health emergency, and folks will have an opportunity to provide us feedback and public comment on all of those. So we'll be sharing all those at that November 10th meeting.
Okay, thank you for that, Ms. Hagan.
Thank you, y'all.
I see Mr. Rivera, you have your hand. You're recognized by the chair.
Thank you so much. There's a lot around the race for the home and community-based services, and we had a lot of discussion about family members potentially continuing to be staffed today. but I just wanted to express, well, first of all, Julie, thank you guys and thank the DD Council for using the funds out of the New Opportunities Trust Fund to go to increase these rates that Julie just talked about. I am a provider of home and community-based services here in Louisiana, and I can tell you it's made a big difference. We increased our rates, this rate increase on September 26th, which I think was a Sunday, and already are noticing a big difference in our operation. So thank you. And my point being, I think it's just more a statement and something for the DD Council to consider moving forward as based on Julie's comments, how we want to get to a living wage for direct service workers, how we want to ensure that this money is going to the workers, full support, is also just letting this body know the importance of the New Opportunity Waiver Trust Fund and the role that this body plays in advising the department on its utilization. I think it was created in 2016 by John Alario. I was back in those days. And it never really got much money because we were going through deficits. But the way that the trust fund works now is when there's a budget surplus, a certain percentage of that goes into the trust fund. And again, we have a surplus this year. So the point is the department is going to really depend on that trust fund. It plays a major role in the New Opportunities Waiver Fund and how that program gets money. So I guess my point to the board is we should consider having a subcommittee or maybe putting that discussion in one of the committees that are currently formed as an ongoing discussion. So that way, when we get asked to utilize that fund or get for our advice what to do with it, we're not on the back of our heels trying to figure this out. And because we all want it to be utilized properly. So again, I guess my thought process, Mr. Chairman, is just keeping in mind that how can we sort of have an ongoing discussion about this trust fund. So when the complicated question gets asked to us, in about 6 months or maybe even 3 months from now, we've had a full discussion with this body and not just a quick reaction. Thank you.
Okay. Thank you for that, Mr. Rivera. And to answer your question, what we'll do is, the last thing I want to do is commit and to making another committee, because we've already have those. I'll get with the executive committee and we'll definitely take that into consideration and see what would be the best course of action to take place, because we don't want to exhaust anybody more by just making another committee. Because the problem we run into is not so much about the topic, it's the quorums. And if we don't have the quorum, then it's hard for us to proceed. But it's definitely noted, and I'll definitely follow back up with you. And I'll be getting with Mr. DeVille and the vice chair about that one. I see Ms. Heimel, your hand is up. You're recognized by the chair.
Yes, thank you for noticing, Mr. Chairman. I want to do a little catch up in that because I know I missed a lot. Also with this one right here, with this forum that we are talking about, is there something all of us is going to do special with the MFP program in that, and how is that going to work, especially in with the program? Are we going to pay for the program, or how is this going with the money as follows, or what, or how is that going to go?
Sure, Rosalind. So the money follows the person rebalancing demonstration, or My Place Louisiana. That is actually a federal grant. and it's been in place for several years now. It was supposed to end a couple years ago, and they did some temporary extensions to the program, but it made it very difficult for states to know exactly what federal money was going to be there to help us. They have given a longer term extension to Money Follows the Person now. And they actually did some additional grants. I wasn't ready to present at this council meeting in advance of that, but we do have some exciting opportunities with MFP coming up. So at the council meeting in January, I will make sure that our report includes a status update of those activities with MFP. You know, what we're thinking, what funding is now available, and do a much better detail information related to the MFP program.
And also, can I at least have the copy of that one as well as, you know, the updates up on it? Because, you know, I want to, you know, have like more info on this one and the updates and how it's going to really, you know, go, and how, you know, the progress is really going, because I am linking up with Pinesville and you know, up there a little bit, because I'm kind of trying to reach out with Oklahoma and that, and Pinesville as well, because I'm trying to emerge a little bit. So I'd rather get all the info. I don't know if that's, you know, I'd rather have that kind of help in the paperwork.
Okay.
Thank you for that. Mr. Rowe, I see your hand. Rivera, I apologize. I see your hand is up. Did you still have a question, or was that just some, it was intentional? Okay, not a problem. Just want to make sure that do we have any more questions in regarding the presentation that was presented by the OCDD? Just a few housekeeping rules. Let's be mindful to 3 minutes, and not only that, we still have other presenters that are somewhat on a time crunch. So do we have any comments from the public?
If Kelly Monroe has her hand raised, and there was also something in the chat.
Okay, Ms. Monroe, you're recognized by the chair.
Thank you. Julie, I had a quick question. When you were talking about the FMAP and the increase that was going to be given for OAS services, the 1850, is that just the CCW, or is that the CCW, LTPCS, and ADHC?
It is the CCW and LTPCS. And then there is also an ADHC is a per diem. So that includes a rebasing for ADHC.
Okay. So now there may be a difference between, now OAS is higher than OCDD services, or will they be the same?
They will all be at 18. Well, in Children's Choice, we're at 1750. So they will be at 1850 for in-home personal care services as the next one are.
And the day services for OCDD is a lot lower too, right?
I don't know the comparison there.
Okay, thanks.
Mm-hmm.
All right, thank you. Did you say we had a public comment?
Yes, we do. From Mary Jacob, she said, if a provider was already paying a DSW $9 an hour before the rate increase, is there any requirement to give them a raise? We are hearing about upset workers because they are expecting an hourly increase.
So the requirement and what we will be auditing is that they have the floor of the $9 an hour. We do know that many providers have told us that they are, are already considering, increasing, but what will be audited and what is actually required is the $9, an hour. One of the things we did share on our provider call too, when we did a presentation on this, is that we'll likely be looking too at kind of like what was average payroll before and after, and that would include things like your direct support supervisors, any nursing consultants that you have, and things like that. All that would be included, because the other piece of that is that there may need, with some of that money, what we're heard from some folks is that while they do want to get it to the direct support workers, there's some inequities, because it's almost like your direct support worker supervisor and your direct support workers pay were getting to be pretty close if you didn't increase both. So while we were looking strictly at the DSW rate of pay at $9, there will be some, again, when we say other associated costs, it's other associated costs that go with that direct support worker, but there's also other associated costs with providing care that are, not related to profit, not related to overhead, but the other staff that you have to have. And so we also know that some providers are looking to use that additional funding to reinvest in the system as a whole for those folks. The other thing we know is that there were providers who did have to begin paying more than the minimum wage and pay more. Some of them had loans that they had to be able to take out and things. So again, it was intended to be flexible. The intent is that it goes to the worker, but we do know that there may be some other associated costs. And so there was a lot of debate and discussion during the Joint Legislative Committee on Budget, as well as the Joint Medicaid Oversight Committee, and hearing the issues and concerns from everyone. That's where we landed on the $9 as the flat fee. For now. Again, I think as we continue to have ongoing conversations, it will help. It will help inform us and help better map out what kinds of things we need to be able to look at and consider to make sure that things are getting to the workforce, whether that's the DSWs or the nurses or those supervisors or those kind of all your boots on the ground people.
Okay, thank you for that, Ms. Hagan. Any more public comment?
Yeah, Ms. Monroe still has her hand raised, and Jill Hano has her hand raised as well.
Okay. Ms. Monroe, you're recognized by the chair.
Sorry, that was a mistake.
Okay, no problem. Thank you. Ms. Hano, you're recognized by the chair. Ms. Hano, you're muted.
Miss Julie, I'm gonna ask this every quarter till your no becomes a yes. Is there a consolidated specific Louisiana summary of ARP? Not to be confused with AARP.
You talking about the American Rescue Plan Act?
Yes.
Yes, the spending plan that we have to submit to CMS actually is a summary that includes an Excel spreadsheet of all of the activities that we're planning to do. And I don't know if Kelly's still on, but that folks will be able to find it there.
Like email that to me.
I have a link. CMS has just made it available on their website. I will post it in the chat if that's okay.
Yes, that'll be fine. Thank you for that.
Like Christmas.
So I don't remember saying no to that before, Jill.
Oh, I swear I thought but like every time I would ask either you or Jen, I could never find it. My bad. I'm sorry.
Not a problem. So listen, we don't have any more public comment or public chat. I don't see anything unless I'm missing anything, Mr. Andrews.
No, I don't see any hands raised.
Okay, so Ms. Hagan, thank you for your report. Your report will be filed. Council members, it's actually 2:50. We're on time for a break. When we come back, Dr. Wilson, we'll start with you. So the time now is 2:50 p.m. We'll return at 3:00 p.m. That way we can finish up on the standing council member reports and we can draw to an adjournment. See you at 3:00.
Excuse me, Mr. Chairman.
Miss Julie, I hope you're not upset with me because I said that. I just know for some reason, maybe I do have, maybe I've never asked, but I know I always look for something specific to Louisiana and I never get what I want, but like I didn't mean to like accuse y'all of anything, and I hope you're not mad at me.
No, ma'am. I think you should
Okay.
be able to ask me anything that you need to ask me, Jill, and not worry about that.
All right, because I look for it all the time online, but I never get what I want, but I think that's gonna be the ticket. Oh, man. Oh, I know.
It's now 3 o'clock. The meeting will come to order from recess. The next item of business we have to discuss is the report from the Human Development Center. Dr. Wilson, you have the floor.
Thank you. Let me just do something real quick here. Thank you. Sorry about that. Thank you, Mr. Chair. So I'm going to try to go quickly. I wanted to just say a couple of quick things, and then, as is our tradition over the last year or so, rather than to have a really long report, normally you would see it in advance. I made a mistake. I failed to forward the report on after getting it back from our person who puts our reports together, Laura. So I'm hoping that if it's not available today, that the council can forward that on to you. I just want to say 3 or 4 real quick things, and then I want to show a video. I'm not sure if you guys received it at the council. I just put it in the chat box. So after I say my little piece, perhaps you could start the video at that point. And it's about 3.5 minutes long. I just want to say real quickly that in the area of employment, we continue to have great support and collaboration with LRS and a number of school districts, and have expanded to actually to the North Shore, to St. Tammany, where we're working with St. Paul's, which is, as you might know, if you know, St. Paul's is not a public school, it's a Catholic school. So that's our first foray into non-public schools to do work in the area of transition. We're also expanding to another partner, again, with support from LRS, and we're not sure which school districts in particular we'll be working with, but we're going to start working with Oshner at their main campus location, and then eventually other campuses, we believe. That's the plan with them, to implement a project search program, which I'm not going to talk about today because of our time limitations, but it will be very similar to the work we're currently doing in Jefferson and a couple of other school districts. Other things, I do want to make this announcement, I guess would be the right word, that we, through one of our federal grants, which is through Maternal Child Health, we have a workforce grant called LEND, which is Leadership, Education, and Neurodevelopmental and Related Disabilities. It's an interdisciplinary grant, so we train people from all kinds of different disciplines, and some include self-advocates and family members, and sometimes early career professionals who haven't begun. Just went mute, didn't I? Okay, so we're going to have a focus in our LEND project on fetal alcohol spectrum disorders. Fetal alcohol spectrum disorders are the largest cause, I guess, of developmental disabilities in the world. And yet, if you look in the DSM-5, the diagnostic manual for determining, whether an individual has a disability or one sort or another, it's not listed in the DSM. So it's very strange and troubling. It costs about $2 million a year to support a person with fetal alcohol, not a year, excuse me, across their lifespan. And it currently costs the federal government, according to the CDC, in excess of $6 billion a year to support individuals with fetal alcohol spectrum disorders. A lot of them end up in the justice system, and the average age of contact with justice system is around 14. And there's lifelong mental health and other challenges that these folks face. very high suicide rate, and the average lifespan of an individual who's on the fetal alcohol spectrum is about 34. The cause of death is typically not directly related to their disability. It's typically problems that they have with other things in their life. So we're going to try to raise awareness about this very prevalent and very debilitating and very expensive disability over the next 5 years, and hope that the council will help us kind of in that work as we begin to map out a roadmap to try to address some of these issues. The other thing I guess I'm excited about at this moment, want to share is we also are opening or planning or collaborating with some partners in childcare to open a community health and information and resource center, and probably in Algiers for the initial one, Algiers, Louisiana, that is, across the river here in New Orleans, and to serve families who have low incomes and have a lot of health disparities and other issues that they're dealing with. Our opening salvo will be, to open with, hopefully we're going to have a vaccine for 5 to 12-year-olds soon. And people who are in childcare not typically, but often have older children that will need vaccines. So it's sort of a way to get kids in, families in. We want to expand this to all the other types of concerns that these families have, opioid crisis, other vaccines that they're not getting, so on, many other things. So it expands, we look at disability, at poverty as really a disabling condition. So we feel like, well, it may or may not meet a functional definition in a DSM or something, that it truly is a significant and high prevalence disability that really impacts a lot of lives. Last thing I want to say is our LASARD project, the Louisiana Autism Spectrum and Related Disabilities Project, is really expanding quite dramatically, especially in the northern part of the state. We're working with in about 8 or 10 parishes up in the northern tier of parishes. I think the only 2 that we don't hit is Lincoln and can't think, but the East and West Carroll. But I mean, we really are in a lot of schools up north, which is great. I mean, that gets us a different footprint in terms of trying to reach people. So with that said, I'm hoping whoever's pulling the levers, I don't know if that's Brenton or somebody else, I put the link, if you don't already have it, in the chat box. And if you could show this little video, I think it shows an example of how we try to train the philosophies that we use around being interdisciplinary and family-centered will be illustrated through this little video. And that's probably all I need to say. I'll be quiet and hopefully we can see the video, and I'll stay here for any questions or comments afterwards.
I don't see that we have a video link in the chat.
Well,
Yeah, that's what I was going to say too.
on my screen you do. And actually it was sent earlier. Oh, there, I didn't hit return, apparently. Sorry. Now it's there.
Are we able to make the video viewable?
I'm trying to launch it right now. I'll share my screen as soon as I get it up.
Thanks, Amy.
Thank you. Seems like you're not having any luck. So what I'm going to do is I'm gonna see, do we have any questions in regards to the report that was presented by the Human Development Center? I don't see any hands. Do we have any public comment? Ms. Imel, I see your hand. You're recognized by the chair.
Can somebody lower the link again from Mr. Paul? I was trying to write it. The messages kind of brought it up, please. And for my question now, I'm sorry, I'm speaking out of turn. And that, how many centers, especially for the like for the drinking ones and that, how many are there that you have for it?
I'm not sure what you're asking me, Rosalind. How many centers for our fetal alcohol spectrum focus? Is that what you're
Yes.
asking?
Yes.
We don't have any specific centers. I mean, unfortunately, the state doesn't even keep a registry that we can find of any sort, because 7 years ago, the birth defects folks decided that not very many kids get diagnosed before the age of 3, which is true. And so I'm still searching. If anybody can help me find any sort of registry or any sort of prevalence type information for Louisiana, that'd be very helpful. We really are starting at ground zero pretty much. I know there's 2 or 3 support groups in the state, but you know, we asked physicians here and medical students here what FASD is, and a lot of them just look at us and go, don't know, what is that? So I mean, it's a huge void that's not being addressed. And so Mr. Chair, if this won't load, I know everyone's had a long day here, maybe we can just put it on the agenda for our next meeting, because I feel like everyone's getting almost brain dead at this point. So
No problem. My request was going to be ask Ms. DeVille to just send it out in an email. That way everyone have an opportunity to watch the video at their own discretion. If they have any questions or want to reach out to you, they know how to contact you by that.
Sure, Mr. Chair, can I just ask the councils, you all have all the emails and whatnot, would you mind sending the link? It's in the chat. And I think what happened, it got emailed to Courtney. So that might not have worked out so well for today's meeting.
Not a problem. Wonderful world of technology. Do we have any other comments from the questions?
Oh,
from
let
the
me lower
council?
down my hand.
I'm not seeing any questions. Do we have any public comment in regards to the report that was presented by Dr. Wilson?
Mary Jacob has her hand raised.
Ms. Jacob, you're recognized by the chair.
Hi, thank you, Mr. Chair. I just wanted to mention to Phil, I had a conversation with the graduate student, I believe it is, that's working on this project. And in our database, we have a little over 30,000 names. And of all of them, we had one person that was tied to fetal alcohol syndrome. That was it, 1 in 30,000 names, which, listening to what you're reporting, is astounding to me, because you would think that there would be at least a couple of other names with it, right? So yeah. I'm wondering if people aren't getting these diagnoses at all, or where the breakdown is.
I think they're largely not getting diagnosed, and I do believe that if you look at the national studies and international studies that have been done on prevalence, it's pretty similar to the prevalence of autism. I don't think there's probably anybody in our group here today who doesn't know somebody with autism. So if you think about it like that, it's kind of, we have a big, and it's not just Louisiana. I mean, a lot of states have a big void in terms of, this is a population of kids that get, a lot of them get, you know, they are looked at like they have attention deficit or they're a behavior problem or whatever, and they never get treated. They actually have, you know, neurological issues that are interfere with their executive functioning, their memory, their ability to understand cause and effect. And a lot of them get in trouble with the prison systems and the juvenile justice. And before you know it, it's a life down the drain, you know? So it's something big that we need to, as a society, kind of rally around.
If there's anything we can do at the PTI to help spread that word, just let us know. We'll be happy to
Gotcha.
jump on that campaign with y'all.
Excellent. Thank you, Mary.
You're welcome.
Thank you for those comments, Ms. Jacobs. I don't see any other hands or any comments in the public chat, unless I'm overlooking anything. So with that being said, the report will be placed on file, and now next item of business is the report of the Disability Rights of Louisiana. So Mr. Roker, you're recognized by the chair for your report.
Hi, Tori with Disability Rights of Louisiana. So as most of you know, our organization does different types of work. The three main areas are legal work for people with disabilities, community means monitoring and advocating, monitoring folks who are in congregate settings and CBS, making sure they're being cared for properly and the rights aren't being abused. And also we do public policy advocacy, of course. So just to go over the highlights of the report, it has been a longish day, I agree. So we do have litigation that right now we are trying to get more mental health services for kids who are in HCBS right now to prevent them from being institutionalized. Again, a lot of what I'll be saying in the few main cases that we're working on that I'll hit on relates to the fact that part of it is that there is a big provider shortage and it's hard to get these services right now. So we are litigating right now to try and get more mental health services for kids to make sure they're not to be institutionalized. That was just recently granted class action status, which allows us to represent a lot more people. So we're pleased about that. We also have a settlement, an ongoing settlement with the State Department of Health that is skilled nursing care for medically fragile kids. They weren't getting the number of hours of service per week that they were supposed to be getting. So the lawsuit got filed.
Excuse me 1 minute, Mr. Roker. I apologize for interrupting you, but I'm getting some comments in the chat where they're having trouble hearing you.
Oh, I'm sorry.
So
probably my fault.
I think that clarifies it.
Yeah, Mr. Chairman, he's like breaking up a little bit. It's like, it sounds choppy.
Oh, I'm sorry.
Okay, it's been addressed. Thank you for that. Okay, you can proceed, Mr. Roker.
I apologize. The internet service in our office is often very bad. Anyhow, so we back in about 18 or 19, we were working on a claim to try and get medically fragile children who are receiving HCBS skilled nursing services they're supposed to get. They were not receiving them or the hours they were supposed to get. We do have a settlement with the Department of Health on that goes back to about 2019. Again, provider issues and worker issues are resulting in it being challenging to be fair to the Department of Health to actually meet those needs. So we're monitoring that and trying to make sure we enforce this, but also trying to work with the Department of Health to get that settlement enforced. There are challenges for provider issues right now. We also were recently granted class action status for litigation that has been occupying a lot of our organization's time. Back in 2018, we filed suit against the Department of Corrections for the mistreatment of incarcerated people, particularly in the Galilee Correctional Institution. This is about people who have serious mental illness being placed in solitary confinement and not being treated. Some significant abuses going on there. I've read a lot of the work and seen a lot of the work and done some of the document on this litigation myself. And so some of the things were happening were not good, to say the least. People were placed in solitary confinement instead of being treated, sometimes placed in solitary confinement when they just announce that they're having some type of mental health issue as punishment, and the conditions in solitary confinement when they're being placed in there are often pretty bad. So we have litigation against the Department of Corrections trying to resolve that issue. It has been granted class action status. Our organization is also a plaintiff in that because under federal law, we have the authority to serve as to be a plaintiff as well. So we're a plaintiff in that. We have class action status that will allow us to represent at least hundreds of people in this. We did have early on some named plaintiffs and clients we were representing. Some of them dropped out for various reasons. Some of them were transferred by the department, frankly. Some of them were, I think, promised better conditions if they dropped out of litigation, as the impression we got. So,
Corey, excuse me, can you just talk a little slower and try to be a little more clear? I'm having really a hard time hearing and making out everything.
I am sorry. Is it more I'm talking too fast, or more that my connection is choppy?
I think it's
Well, you're speaking a little fast, and I'm trying, to understand you, but it sounds like it's a little choppy, just this much choppy.
That's a problem with me. So anyway, we do have we have class action litigation against David Wade Correctional Institution over their treatment of incarcerated people with mental illness, in particular solitary confinement of those people. This has been going on for a few years. It has taken a lot of our resources. Trial is scheduled for January. There is a damages phase scheduled for the summer, I think July. Again, we are a named plaintiff in that lawsuit. We also, again, we're granted class action status, which allows us to represent a lot more people. So far, the litigation seems to be going fairly well. Our legal team is doing well. Again, it has taken a lot of time. We spent a lot of resources on it. This is consuming a significant part of our PAMI grant, which is our grant to help folks with mental illness. It's the Protection and Advocacy for Individuals with Mental Illness grant. So we devote a lot of resources from that grant to this litigation because the conditions that some people were being kept in solitary confinement because of their mental illness were not very good. And that is ongoing. Hopefully that trial date will stick and we will be at least to the trial phase of that in January if everything holds up. We have, of course, reached out to settle this on a number of occasions and not really met with a good response. Our community advocacy department, which advocates for people who are in congregate facilities and HCBS, has filed several complaints recently. We monitor all the 518 group homes in Louisiana. We do have a limited capacity to monitor people in HCBS, but we have filed nine complaints since August, including, and those complaints include things like the physical abuse of patients, not notifying the family of evacuations, physical injuries to people, insect bites, extreme weight loss. There's a list here. It's not a very nice thing, all this. So it's our people, our staff are monitoring for that. We file complaints with health standards, and health standards will investigate, and we will follow up on that. Legislatively, we are currently working on, actually tomorrow we have a meeting scheduled. The Law Institute has a meeting scheduled. There was legislation introduced last legislative session that would have banned the abortion and sterilization of interdicted individuals. The current process in the state of Louisiana is largely a rubber stamp process to where people who are interdicted, they can have somebody who's the guardian can go to a court and pretty easily have an abortion or sterilization approved without due process. It's likely an unconstitutional process currently because there's really no process for it except for a rubber stamp, more or less. State rep last term introduced legislation that would ban the process entirely, which also probably doesn't pass constitutional muster and also would violate the rights of individuals who are evicted. We worked with the state rep and tried to, and actually drafted language for an amendment that would actually make what he was doing constitutional and also respect the wishes of the people who were convicted in these matters. The state rep who was doing it didn't want to change things on the fly, pretty significant change. That's it's a challenging piece of legislation. So instead, it was kicked over to the Law Institute, and the Law Institute is having its first meeting in a while tomorrow, and I will be in that meeting to discuss this, and one of our attorneys who was involved in working on that will be in that meeting as well to discuss this. That's a brief summary of the high points of the report.
Okay. Thank you, Mr. Roca. Do we have any council members with any questions in regards to the report that was just presented by Disability Rights Louisiana? I don't see any hands. Do we have any public questions or comment in regards to the presentation that was given by Disability Rights Louisiana? Okay,
I was going to say Rosalind has her hand raised.
Ms. Hyman, you're recognized by the chair for your comments.
Yes, thank you for recognizing me. The question is to you is there other states like you mentioned, and also in the state you mentioned Louisiana, and that is there other states you said that you try to get like information from? If I'm understanding you right.
I think you cut out a little bit, but if you're asking if there are other states that we're trying to get information from, we do sometimes work through our sister organizations in other states to get information about things, just to see where Louisiana is relative to other states. There is one of us in every state, every populated U.S. territory, DC, and there's one of us for Native Americans. In terms of requesting records, using the authority that we have to request records from public authorities, because we do have federal authority to request public records to do investigations. We don't use that in other states because there is one of us in every state, territory, et cetera. Our sister organizations in the various states would be doing that work. So if something comes up in, say, Georgia, we don't do that kind of work. There's one of us in Georgia that does that work. It's a separate entity, but part of our national network.
Thank you, Mr. Roca. Do we have any other comments or questions from any council members? Do we have any public comments or questions in the chat? Not seeing any. Your report is recognized and will be placed on file. At this point, we're almost at the conclusion of the meeting. We'll take questions.
Mr. Chair. Ms. Karanda Corley has her hand raised.
Oh, I apologize, Ms. Corley. You have the floor.
Thank you so much, Mr. Chairman and full council. Due to the internet access, I could not understand exactly what Mr. Rocca was saying in regards to the lawsuit that will be going to trial in January. And I was hoping that he could give us some information, since now we can hear him a lot clearer in regards to that lawsuit without compromising the lawsuit. If he can, and if he will also, if that will also be included in the report that will be made accessible to the public before January.
Sure. So there is a summary of that included in the report that I submitted to the council. There's a summary available. And in terms of the litigation, so this goes back to before I started working here, I think about 2018. Our organization did an investigation into conditions at David Wade. People with mental illness were being incarcerated in solitary confinement, sometimes as effectively as punishment for having mental illness. Sometimes when they told the authorities in the prison that they were having some type of mental health issue and wanted to get treatment, sometimes they would be placed in solitary confinement just for that. The conditions in those cells were not good. They could have all of their stuff taken away, sometimes restrained to a chair for hours at a time, left in nothing but a hospital type gown, sometimes with the window open when the weather was very cold outside. So we investigated that years ago, found those conditions there, which of course are terrible, and decided to file a class action lawsuit. We initially had some named plaintiffs. I think all of them may be gone now. Again, some of them had various reasons for leaving. Some of them were transferred by the Department of Corrections to other institutions. Some of them, our interviews with them seem to indicate they were offered better accommodations if they would not be part of the litigation anymore. Fortunately, under federal law, we actually have authority to serve as a plaintiff in litigation like this. So we actually did go through the necessary steps to become a plaintiff ourselves. So our organization is a plaintiff in that lawsuit. And fortunately, we were just certified as a class action. The litigation was just certified as a class action, which allows us to represent hundreds of individuals in the prison. And that litigation will be going to trial as long as everything goes according to schedule in January. And there will be a damages phase, which I think will be happening in about July.
Okay, thank you for that. I see Ms. Heimer, your hand is raised. You're recognized by the chair.
Yes. You mentioned about like the different cases, especially with the courtroom and that. How many are there with that and all, with the cases in January? Like that y'all get?
I don't know that we have any other trials scheduled in January. I don't know of any that we have scheduled. Most times when you file litigation, you don't have a lot of trials. A lot of things settle out of court. So a lot of things that when you file litigation, they don't even go to trial. So I don't know of any other litigation that we've filed that is coming to trial in January. If I had to guess, I would say probably none. We have in terms of outstanding litigation, my report doesn't detail everything we have that our lawyers have filed, just several, but I don't know the number of exactly the number of court cases we have ongoing right now. Again, a lot of them result in settlements beforehand, and that's ideally what you want to do. You like to try and settle things beforehand and not litigate and not go to court, but sometimes that is just not feasible.
Thank you. That's what I was looking for.
Vice Chair Banks, I see your hand. You're recognized.
Thanks, Chair, for recognizing me. So since you guys have got that status of class action, just excuse me, I'm just picking up my kids. Since you guys have gotten that class action, do you guys seek out those individuals to represent, or you are getting them to come to you? Like, how does that go? Because I know a lot of inmates probably don't know, what's going on. So how are you guys filtering out which cases and which individuals you guys are going to be representing? How do y'all do it? How are you doing that?
So initially, when we filed the litigation, we sought out individual plaintiffs to represent. And we did. We had individual plaintiffs that we interviewed that we represented. And all or most of them, for various reasons, decided to no longer be plaintiffs in the litigation. Again, in some cases, they were moved from the prison to a different institution. Sometimes, in our opinion, they were offered better treatment or better accommodations by prison authorities in order to no longer be plaintiffs in the litigation. So we initially did based upon our investigation, seek out individual plaintiffs and represent them. Most or all of them are gone now. I don't know if it's all, I have to double check on that, but most or all of them have left for one reason or another. The class action allows us to represent hundreds of people as a group. So we're actually representing just a group of people, representing their interests based upon the documents we've received for discovery that tell us what's going on in terms of people not being medicated properly, people not being treated properly, people not being treated at all, people being placed in solitary confinement when they shouldn't have been, all sorts of things like that. So we have a lot of evidence over 3 years or so of gathering evidence and documents and testimony and depositions from various people who have been involved in the lawsuit. We can move forward as a class representing just hundreds of people now. So we don't need to have individual plaintiffs when we have a class.
So you just gonna the ones that you guys have basically right now, that's the ones that you represented, and any ones that falls into it can also qualify for anything that is gained from the lawsuit, correct?
Anybody the judge says that we can represent. So that's the class.
Okay.
Thank you for that clarification. Do we have any other questions from council members or the public?
There are no hands raised and nothing in the chat.
Thank you again for your report. There's no action needed to be placed on file. At this time, do we have any announcements?
Lillian Dejon has her hand raised.
Ms. Dejon, you're recognized by the chair.
Thank you. I have no announcements, but just a comment. I'll be rolling off the council very, very soon. And I just want to point out that after I roll off, we will have 0 youth or 0 young adults on the council. And this is obviously a big issue because we know that the DD service system also impacts young adults and youth. We understand that they're actually greatly impacted. And so in Oklahoma, they actually have 3 young adults on their council. And I understand that we're making strides forward here by trying to plan a YLF, but we're looking at a 2-year timeline on that. So I would just really, really encourage the council moving forward to really, really make an effort to start recruiting young people to be on the council, because we really need that perspective that we really haven't had. So I just want to thank you guys for your time and also for embracing me for the time that I've been here. So thank you.
Thank you for those comments. And that is something that one of the things that we are pressing forward to address with the DD Council is to make sure to have it as broad as possible. That way no one can accuse us of being one-dimensional. And I also encourage everyone, if you know any people or any individuals that may be interested, that may be across a broad span, please let them know about the council, because the only way we're going to see changes and improvements are based upon the people that we're able to connect with. I see Ms. Jill Hayno's hand.
Well, again, Dr. McKee isn't here, but I know I saw Bambi and Rashad and the membership. I thought last night I was reading all the bios for the incoming or the membership committee recommendations, and I thought I saw one that was for a youth.
You did, Jill. There is one self-advocate that is under 18.
Okay, and I should know this, but is there a age limit or how old do you have to be to join the council?
I can actually answer that if that's okay, Mr. Chair.
Yes, Ms. Dejan, you're recognized.
It's actually very convenient. There doesn't really seem to be an age requirement. The Senate does get a little bit irritated because you haven't filed tax returns, but once you explain that you're a dependent, they're very understanding.
Okay.
Thank you
Well,
for that
I'm sorry
clarification.
to see you leave and keep in touch.
Yes, indeed. Okay, Ms. Heimel, I see your hand raised. You're recognized by the chair.
Yes, I do. Actually, I'm going to answer Jill Hoke's question as well. It's okay, Jill. It doesn't matter on the age. I'm answering your question. To me, to join with this, age doesn't really, you could stop me though, Mr. Chairman, if I'm wrong or right. I thought age itself doesn't really matter when you join up with a council. And also too, I'm also agreeing with Lillian. And Lillian, I hate to see you go in that. I wish you could stay another year, but hey, keep up with you. But I do have to tell you, she's been aspiring me to go on. And if y'all need any help, I could, I've been with Oklahoma, and also I went up to Lafayette. Yeah, Lafayette. I mean, another one besides Lafayette, to Pinesville. They had a very pretty thing over there I would like to really speak about, but it's really pretty. But I would like to get with Miss Mary with that. It's in Alexandria. And I would like to really join up with that and find all the information, if I may, Mr. Chairman, on that. I wanted to bring up to you and see what can I really do on that. I wanted
Okay.
to bring it up to you.
Okay, and I'll follow with you offline because there are definitely some things that we can discuss to see how we're able to make it as advantageous as possible for you and also for the public in which we serve. Do we have any other questions or any announcements from the council members? I'm not seeing any hands. Do we, Ms. Polozzolo, I see your hand. You're recognized by the chair.
Yeah, we have several people who I believe is their last meeting. So I think it'd be appropriate just to honor or just to recognize them and thank them for their service to the council.
Please do.
I don't know who they all are. Lillian just said.
Do we know exactly who's rolling off? I tell you what, simple.
Yeah.
You know who you are. Raise your hand. Raise your hand electronically. That way we can recognize you by name. Okay, we have Ms. Dejan. Who else? She's the only one I see on my screen at the moment.
Miss Carmen Setnar is rolling off.
Okay.
Mr. Michael Billings, who's already left the meeting, that he's rolling off.
Okay.
And Mr. Stephen Nguyen will be rolling off as well. Miss Tamisha Victorian, who I don't believe is on the call, but she is also rolling off. And Mr. Randall Brown, previous chair.
Senator, I see your hand as well. Okay. So on behalf of the council, we definitely want to say thank you for your service. Thank you for your contributions to bring the DD to council to the point to where it is now. Had it not been for you doing what you did then, we wouldn't be where we are now. Thank you so much for your service. please do not be a stranger. Just because you don't sit on the council doesn't mean that you cannot be part of the public chat. Because again, any hands lighten the load. So thank you so much for your service. We hopefully you're leaving with, you're leaving the council refreshed, not with regret. But if you do have regret, please come back, because we definitely will leave. It's like Motel 6. We'll leave the light on for you. Do we have anyone that's rolling off would like to say anything? I definitely don't want to rob you of saying, giving you opportunity with this being the last time. You can remain time conscious. I'm going to ask that for about within the next 5 minutes that you give give what you have to say. That way you can remain compliant with the time.
I believe Carmen and Stephen have their hands raised.
Mr. Nguyen, you're recognized.
I would say ladies first, so I yield the floor.
Ms. Carmen, you're recognized. Mr. Nguyen's been a gentleman.
I really don't have anything to say. Thank you to all of you for being such good advocates. I enjoyed my time. Thank you.
Thank you, Mr. Nguyen.
Yeah, I just wanted to take the time and thank you, Mr. Chairman, and thank you all the council members, council staff. The last 4 years has been quite an amazing ride, and I've met some amazing people along the way, and I consider you all very dear friends and colleagues. So keep up the good work, and I know we have a lot of work to do as a state, but I think with the people in place, we will go far, and let's make it count. Thank you.
Thank you. Anyone else? Do we have any comments in the chat? Ms. Heimel, I see your hand. You're recognized.
Yes, I really want to say something really nice about one of my members here on council, and I really want to say that she is a really best friend to me. I'm glad to really know her, get to really spend my time in her 4 years, and that's Lillian Dijon. She gave me the biggest helping hand of the 4 years that she was really here. I appreciate it, and I want to really take my time to really leave her know and to really say it. Thanks for all the things that you really did for me on the council. And I really appreciate having you as the best friend ever. Thank you, Lillian Dijon.
Thanks, Roslyn. We're going to be friends for a long time.
I do appreciate it, and that's coming from the bottom of my heart. I'm going to miss you, and I will keep up with you.
You better.
Yes, indeed. Do I see any more hands, any more comments?
No more comments, no more hands raised.
Okay. So as a chair, I just want to say again to those who are rolling off and to all of the council members present, thank you for being a light in the midst of breaking a dark cloud. We're really moving forward. I just thank you for all your contributions and all your service. Since there's no further business and there's no objection, I move to adjourn the meeting.
Rashad, I believe you do have a hand raised. Yeah,
Okay.
Katie Crows.
I'm sorry, then repeat the name again, because I didn't see
Katie
it.
Crows.
Okay, you have the floor, Ms. Crows.
Hey, can you hear me?
Yes.
Okay, thank you, Mr. Chairman. Yes, I'm Region 2 Lacan team leader, and my question is, when might we see a return to in-person activities and events? Thank you very much.
That's a good question. I'll answer that one as the chair. In the first part of my comments, I've made a call to several of the Lacan leaders. it's really going to be a judgment call based upon how, if you feel that it's going to be safe for you to do such, because we're not going to make that at the moment. The council's not going to make that imposition because there's so many extenuating circumstances, so many dynamics out there. Now, if there's something that you would like to see within your region and you feel that you have the support, and I'm talking to all the CAN leaders, reach out to us, let us know, and we'll try to make an informed decision to support you. But we're not going to make that imposition at the moment. It's going to be based upon so many different dynamics. Hopefully that answers your question.
You also have Miss Kelly Monroe has her hand raised.
Miss Monroe, you're recognized.
Hey, I'm sorry. Would that be the same for the other, for the contracts that are, that we hold? Like for some of our training, some of the people are ready to get back in person. And so would that also be for, some of the trainings that we do?
Like I said, it'll be a judgment call based upon the individuals and the regions, because there's mixed signals when I talk to them. There's a certain element that's eager to get back out there, and there's a certain element that has reservations. So it's just something that we would have to really just look at, in my opinion, on as chair, as a personal individual basis. But I don't want to make that imposition on an entire entity based upon the fact there's so many different dynamics. Hopefully I answered your question.
Well, is that something that the whole council has to vote on, or is that just something that we can kind of do? I just want to make sure that if we do go in person, that that we're still following, you know, y'all's expectations.
I would prefer it be something that we have a discussion with the entire council. I think by January, that'd be a good time when we have our meeting on January 19th and the 20th. I think that would be the best time to have that conversation, because at that point, we'll know exactly what direction our state is moving in. And at that point, we'll know exactly how to do it. At this point of the year, there's really not much that can be done based upon the fact we moved into a holiday season. I know a lot of agencies are just starting to somewhat coast until the 1st of January. But it's definitely something that we can bring to the council if that's something that the supporting agencies would like to know about.
Okay, thanks.
You're
So
welcome.
Rashad, sorry, this is
Yes.
Brenton. Just trying to get some clarity since I'm over Lacan. So is this something you're gonna, the council is gonna address in January? Because the logistics of a judgment call per leader honestly is not really gonna work. We either have to do it or not do it. So I didn't know if this is something y'all plan on addressing in January, so we're still not in person until then, or if we were opening it up. I'm kind of confused here.
Okay, well, let me bring some clarification. At this state, we'll remain as we are. Now, if this is something that, Brenda, they would like to be brought up on the agenda for the next council meeting, let's make that decision. We'll do that. That way we can bring before the full council.
I mean, I think that makes sense. I do think as long as things are suspended or modified, it should probably be something that's addressed quarterly. That's just my opinion. And I do know that some do want to get back in person. Some are still uncomfortable. We've also heard that feedback from some of the Lacan members. So I think just doing as we are and then putting it on executive committee's agenda for January is probably a smart thing.
That was going to be the next thing I said. That would be something we would bring before the executive committee, that we could bring it before the council. But as of this, we're going to continue to retain where we are until a formal decision is made.
Okay, thank you for that clarification. You do have hands raised for the council, Rosalind, Bambi, and Jill Hano. And I see Kelly Monroe also has her hand raised. I don't know if that's as a follow-up. Oh, it went down. I guess that was a mistake. Right. So just Rosalind, Bambi, and Jill Hayno.
Okay, and I do want to make emphasize this: the governor's order has not been lifted as well, so we got to make sure that we remain compliant. Okay, Ms. Heimel, you're recognized by the chair.
Yes, thank you. Now this is what I want to know. Are we going to continue with 3 meetings like this week, like we had this week? Because for me, is there a way, because I really feel bad about it because I missed Monday's meeting and I forgot I read it, I read my paperwork and I didn't think about it for my region and that, and all. And I really, or is it just going to be like Wednesday and Thursday? How many meetings gonna be like the 9th, like you say, 19th and the 20th?
Well, the executive committee meeting would be the one that was on the 19th, just for clarification. And the full council meeting would be the one on the 20th. That's what I was referring to when I gave those 2 dates. Now, to answer your question, that's just based upon whoever the chairman is of the committee that you're sitting on.
Because for me, I totally missed it and everything, and I don't know what was said in mine, and it was on the 18th. So does that really going to stay that way, or no, or what?
Let me ask a
Or
question.
the
Mr.
one I'm
Bill,
in?
that video, was that meeting that she's referring to, was it recorded to YouTube?
It was recorded and available on YouTube. Also, our meetings every quarter, as long as they're virtual, the scheduling of them changes a little bit based off of the doodle polls that we do and availability. So it's all within that week, and each individual committee meeting changes a little bit. The executive committee stays the same, and the full council always stays the same.
Okay, thank you for that. So Ms. Hyman, to answer your question, even though you did miss out on Monday's meeting, you can still be informed by going to the YouTube channel and then get caught up to speed by looking at the previously recorded video for that day. That way, when you move forward, you're moving forward fully aware of what's transpired in your absence.
All right, thank you, because for me, I'd rather catch up on that, for that one particular day, because I want to know what was said in that. And that way I won't feel so bad about it.
You're more than welcome. Ms. Polozola, I think you were next in line. You're recognized by the chair.
Yeah, hello, can you hear me?
Yes.
Okay. So I know that, we have to stay within the guidelines of the governor and also CDC, but I also know that people are, just for mental health and a lot of other reasons, that people are looking forward to the continued progress, hopefully, of us, doing well with the pandemic and our numbers staying low. So is there any way, and I don't know the timeline of getting things organized, but is there any way that it potentially could have an in-person meeting in January? Or is the timeline too long advanced to be able to get that done?
We might not be able to do it at this point because it would take us a while to organize the hotels and the room and everything.
A lot of logistics at the moment.
Yeah, I was also going to say it'd be difficult to default to our typical hotels. If we have to do the spacing option, they might not be able to accommodate us due to the size room that we would then need. And I don't know where we would go from there.
Ms. Hayno, I see your hand. You're recognized for the chair.
In this all, like, I feel like this is probably a more passive approach. But we can't even think about this until we know if he's gonna lift the PHE and the rate we're going, if I had to guess, because for 2 years, every time he gets a chance to lift it, which shout out to Edwards, he's amazing. Every time it comes up for renewal to suspend the PHE, circumstances say, oh, it's in place for 90 days, and that has been going on for 2 years. And again, like, this is probably a more passive approach, but like, aren't we, or could we not know the other options, but aren't we at a standstill until we know in January if the answer's yes or no to extending it, the PHE?
Correct. And listen, I don't want to get too distracted on chasing the fat rabbit where we're not on whether we're going to adjourn or not. Like I said, that's a logistical issue. And the best thing to do is, like I said, we'll bring it to the executive council, and then the executive meeting bring it to the full council. But I don't want anyone to get premature conceived notion that there's going to be any kind of action taking place before January. Because like I said, there's a lot of logistics to work out. And I can pretty much tell you that the answer is going to be no, just due to the fact there's so many dynamics and so many moving parts. Do we have any more questions? What about in the chat box?
The only thing in the chat, it was related to the discussion of in-person from Susan Reen, said, shouldn't we be following CDC guidelines and LDH?
So if there's no further business and there's no objection, are we going to adjourn the meeting?
Yes, you can adjourn.
Move to adjourn. Thank you so much for your time.
Good first meeting, Mr. Chair.
Yes, indeed. Y'all have a great one. I know I won't see anybody for the most part, but y'all have a great holiday season.
You too.
Bye-bye.
You too. Bye.